May is National Stroke Awareness Month, and here to discuss stroke risk factors, the importance of keeping healthy, and the latest stroke research is Jeff Klingman. Jeff is the Neurology Chair of the Permanente Medical Group. Welcome, Jeff.
Hi, thank you for having me.
Yeah, we appreciate you being here. We have some questions, so let's get right to it. How has COVID-19 impacted stroke patients that need treatment?
So it's pretty interesting. We've seen a pretty dramatic reduction in the number of people showing up to the hospital. At Kaiser Permanente, we have a neurology program where stroke neurologists see every stroke patient as they arrive in the emergency room by video. So we're old hands at this video thing. We've been doing it since 2015. And we see everyone and we make a note. So we actually get to see what the entire population looks like. And what we noticed that as soon as COVID started to hit and shelter in place came on board, there was a dramatic reduction in the number of patients showing up with stroke, at least a 30% reduction. And in some areas, it was even greater than that. So in harder hit areas, it seemed like people were staying home even more. This is pretty disturbing because stroke is very treatable if you get to us early. And so what we're concerned about is where all the stroke patients went. We just got done analyzing, and it appears that what happens is they're just staying home. We found a drop in stroke admissions that actually paralleled the drop in stroke calls. So not only were they weren't coming in late, they just aren't coming in. So the concern is people are staying at home and having strokes and not being able to be treated. Stroke is the largest cause of disability. So it's pretty concerning that people aren't showing up.
Yeah, very understandable.
Colleagues in cardiology have seen the same thing, dramatic reduction in heart attack admissions.
Yeah, like I was saying, that's very understandable. And there's a risk if you're trying to ride it out or if you're waiting to see if you just start to feel better. Talk about the possible side effects for those who don't go for treatment at the hospital immediately.
Yeah, right. So if we can get to people quickly, we've been able to show that even 30 minutes faster improves your outcome. We've got a lot of treatments available for stroke that we didn't used to have. We can give clot dissolving medicines. We can have catheters inserted to pull the clot out. And if you wait, you definitely end up with more potential for disability and even death. And so there's been concerns across the country, and several areas have seen that there's actually increased death rate during COVID, more than just related to the infection, because we think people are staying home and not availing themselves of the medical system.
Right, and if someone suffers a stroke, they need to get to the hospital for treatment.
They need to call 911. That's our number one message. We get people saying, well, maybe it'll get better, and then we lose our opportunity to treat them. We get people driving in, and that's actually slower treatment than calling 911. So if I had one message to give people, if you get stroke symptoms, call 911. It's perfectly safe to come to the hospital, and it's a lot safer to come in than to try this at home. One of the problems, I think, is that people that are having strokes, the organ that decides to go to the hospital is having a stroke. So it's really important for family members to be aware and make that call. We also hear people say, well, I'm feeling okay, I don't want to go in. And if it's the family member, make them go in, call 911, because it really does make a huge difference. People that stay home and get strokes or end up with paralysis and may end up falling and having permanent problems.
Yeah, you talk about people that, they're being affected maybe by that organ that's causing the stroke. So the people around them need to be aware of the signs. Talk about what those signs are. What should people be looking for when it comes to stroke?
Sure. So an easy way, there's a scale the Heart Association came up with called FAST, which stands for face, arm, and speech. One easy thing to do is this person having problems with their speech? If so, it could be a stroke. Sometimes we'll see facial weakness, and that's something that's pretty easy to see. So if there's substantial facial weakness, that can be a sign of a stroke. And then if you just test people when you watch their arm, if it drifts down, that can be a sign as well. But it's not the only one. So severe difficulty with balance can be a problem, leg weakness, kind of neurologic symptoms, something new that's different deserves a call to 911. One thing that I notice is that people often say, well, I didn't have a headache. Well, most strokes don't cause headaches, and some do, but most don't. So don't wait for a headache. Anything that's new and different, it can be hard to figure out. The best thing to do is call 911, get taken in, I look at people all the time and say, yes, it's a stroke, it needs treatment, or no, it's a stroke and it doesn't. But it's hard to determine that on your own.
Right, and if you do see someone experiencing a stroke, or if you are experiencing one, you said call 911. Is there anything else that they need to do?
Not really. So one of the things was people often say, well, I took an aspirin, and it's okay, but you're much better off getting in quickly. The key thing is to get in as fast as you can, because all of our treatments are very time sensitive. We've really only got up to 24 hours in a few cases, and mostly the sooner we can get there, the better. We just looked at data reducing our treatment times from an hour, which is pretty standard, down to less than 30 minutes, which is at most of our hospitals, we're able to treat people in less than a half an hour. And we actually saw that people had better outcomes and, in fact, even lower mortality. Just moving that bar by 30 minutes seems to make a difference.
And doctor, you talked about the number of stroke patients coming in, dropping. I think a lot of people are worried about going to the hospital. They're worried about additional health risks. Tell us, is it safe for stroke patients to go to the hospital, even if there's a risk of catching something there?
Absolutely. I think there was a lot of fear early on, and there was a lot of consternation when we didn't know as much about this virus. It is absolutely safe to go to the hospital. You definitely want to go in. You may see people dressed in all kinds of interesting protective gear. First time COVID started to hit, and I was on the video in San Jose, which was heavily hit, and it looked like people were wearing spacesuits, but they're still taking care of the stroke patient. And the stroke patient, if you go to the emergency room, you're going to be safe, and you're going to be a lot safer than trying this at home. So that's kind of the big message for stroke awareness is if you see symptoms, call 911. Don't drive in. Don't wait for it to get better. Don't call your, grandkids to see if it's okay. Don't call your relative that's a doctor on the East Coast. Just call 911.
Dr. Jeff Klingman with information about stroke and stroke awareness. Thanks for joining us.
This interview involves commercial content. The products and services featured appear as paid advertising.